It doesn't matter if you're a man or if you're a woman. If you suffer with hair loss, it's devastating to your self-esteem. I'd like you to meet Kendra Clark. She's from PCI Wellness, and DJ Shooter. He's a representative for Eclipse, and they are here to tell you about how hair restoration, a procedure called PRP, it's working. Good to see you.
It does. Thank you.
How common, Kendra, is hair loss in men and women?
Well, we know 50+ million Americans suffer from hair loss, and 40% of those are women, so it's quite prevalent.
Right, and then when we get in that mirror and things start coming out, we're like, wait a minute, what's going on? And
exactly.
you say PRP is a very good alternative. What is that?
It's an excellent alternative. PRP stands for platelet-rich plasma, and what it is, it comes from whole blood. We spin down whole blood in what is called a centrifuge, and what we would do is we inject the patient's own blood into the scalp.
Okay, so who's an ideal candidate for this type of procedure?
Well, men and women, fortunately, both benefit greatly from this procedure. And patients with any hair loss, of course, male pattern baldness, we know that about 95% of that particular hair loss does very well with PRP. And we also say anybody short of being what is called Mr. Clean.
Right.
So we say if you've been Mr. Clean for less than 4 years, you're a great candidate.
Okay, so but you'll come in and you'll do a consultation, right? To see if we can grow our natural hair. What can someone expect in this procedure?
Well, we start by an in-office treatment by using the PRP injections, and then what we do is we send them home with a helmet, and the helmet's to be worn twice a week for 20 minutes.
Okay, so that's the device I held up. Okay,
yes,
it's
correct.
A little light up.
It's a low laser light therapy at home, and then of course we also have nutraceuticals that target other elements that contribute to hair loss, such as environmental issues, genetics, of course, inflammation, free radicals, so the other variables that are associated with hair loss. So with this trio therapy that we have, it's very beneficial in addition to the PRP treatment in the office.
All right, so DJ, you were not Mr. Clean, but you did start noticing, you started noticing some hair loss. Why did you decide to undergo this treatment?
Yeah, just typical kind of male pattern, right? Middle-aged male where I have a receding hairline, and I knew I wasn't really going to be a candidate for hair transplant. I didn't want to undergo surgery and spend $15,000 or $20,000. So when I heard about this platelet-rich plasma treatment, this PRP hair treatment is something that was an alternative that actually is regrowing new hair for thinning hair. As someone like myself, that's why I decided I wanted to do it. For me, it's a 15-minute treatment, in and out. Was able to get back to work even that same day, and so that's something that interested me.
What was the recovery like for you?
Yeah, so again, like I said, 15-minute treatment, and that I went back to work that same day.
Wow.
So
okay.
It's one of those things that really is not too painful.
So we're looking at some before photos of you. That's on the left side of the screen. So you just looked in the mirror and said, "Uh-oh, is this hereditary?" Kendra?
It can, but certainly genetics plays a part. But as I mentioned, inflammation, advanced age, hormonal triggers, pregnancies, stress events. There's a host of variables that play into this.
So you had this done six months ago?
Yeah.
Okay, and you've seen a huge difference.
I've seen it great. About 3 months, I started seeing results. Really happy with it, and I think if there's anything that I could do to just kind of keep the hair that I do have, let alone grow new hair.
So Kendra, is this his natural? This is his hair?
This is his natural hair.
Okay, rub your hands through it. I was going to ask you to do that.
Here.
So this is your real hair. Did you ever think that you would be able to get a handle of the thinning?
Well, 5 years ago, I never even thought about thinning hair until I did see this a couple years ago, and the fact that I could take my own blood and re-inject that into the scalp and grow my own hair back is pretty cool.
And he wears the helmet when he watches TV or eats his breakfast.
Yes, he had it on earlier, and it's very comfortable, right? You don't have.
You might see me driving down the 101.
Yes, he actually does drive with it.
With your helmet, so you didn't have any pain, and you just wear the helmet, and it stimulates that scalp. And that consultation, I can imagine, Kendra, it's very critical to figure out if you can, of course, have great results. Would you recommend this?
Yeah, I have recommended it to family and friends, and some of them have been getting on this regimen as well, taking the supplements, Nutrafol, along with the whole
So come in and see you, and that's a free consultation, which is great.
Absolutely.
So you can tell.
We go into detail on everything there. So.
And men and women, welcome. I know DJ's a guy, but I'm sure women are overjoyed.
Absolutely, 40% are women. So
all right,
it's exciting for us as well.
Well, good luck. It looks wonderful.
You thank you very much.
You're wearing your helmet. Let's give you a special offer now. If you mention Sonoran Living, you will receive a 25% discount on hair restoration protocol. That is for the first 50 callers. Consultations, they are free, so please call 480-773-6450 or visit their website, PCIwellness.com.